For our practice today, I want to talk about a multivitamin, so why we sell a multivitamin. The practice has been open almost 7 years. This November will be 7 years. And if you'd have told me when I opened that we'd sell a multivitamin, I would have laughed you to scorn. It wasn't on my radar screen kind of thing. In my mind, every multivitamin was the same. But the bottom line, there's about 3,600 different multivitamin manufacturers in the world. They've all been rated, by the way, for quality and bioavailability. It's quite amazing the data that's out there. The top 3 in the world for the top 3 multivitamins that are sold in the world are $400 to $800 a bottle. Phenomenal stuff, but they're for kings and presidents, sheiks, not for normal people. They're phenomenal multivitamins, but $800 a bottle. The average person can't afford it. But the 4th best multivitamin in the world is a company in LA, all right? And phenomenal stuff. They're big horse tablets and they smell funny. But if you take that multivitamin, it is an amazing thing. I tell my patients, you take it for 2 months. If you they're expensive at about $35, $36 a bottle. But this is the 4th best in the world. A lot of people, by the way, in this area use Centrum Silver, and they advertise a lot. It's in the bottom third of quality for multivitamins, by the way. But what I tell my patients, if I ask you to take it, you need to take it for 2 months. It takes about 6 weeks to 2 months. If it makes a difference, you had a deficiency, you need to take it forever kind of thing. But if it didn't make any difference after 2 months, buy the cheapest one around kind of thing. The other thing is that we ask our patients who are taking high-dose vitamin D3 that for those first 2 months, they have to take our multivitamin. And the reason for that is not so much the quality of the multivitamin, but it has very high-dose vitamin K2, which you have to have if you're taking the high-dose D3 so you won't get in trouble with some other issues. But that's why we sell multivitamin, all right? It's a phenomenal multivitamin. One little tip, by the way, that if you absorb things well and properly, a little tip, if you take our multivitamin twice a day, plus you take a teaspoon of honey with a 1/4 teaspoon of Himalayan pink salt every day, as long as you have no kidney failure or heart failure, it's very, very safe. Ask us if you think it's questionable whether you should do this or not. But if you do those 2 things with the multivitamin, there is not one single mineral, vitamin, trace element that you will be deficient in. And that's quite amazing. Today I can do a special test to check that out. It's about $800 to $1,200 to check that out, to see that there's none of those trace elements missing, all right? But it's just cheaper to do it for 2 months. And if you feel better, you probably had some issue there and you need to take it there because there's a problem there. If it didn't make any difference, there probably was no issue there, and you can go ahead with it. The last thing about the multivitamin that's important, a couple months ago we asked them to change the form of the folic acid to the methylated folic acid, which is much more effective. So if you take the methylated folic acid, for an extra $10, $12 a month, you can buy this phenomenal multivitamin with the methylated folic acid in it. You don't need to take the methylated folic acid in addition for most patients. Okay, thanks for belonging to the practice, and that's why we sell multivitamins.